Hi, Dr. Pelto here. I had a question from a patient recently. The question is, what is a bipartite sesamoid? Recently, I did a video on turf toe, and I did a video on a fractured sesamoid. A fractured sesamoid is very similar to a bipartite, and I want to explain that. I'll put actually the video on the side of the fractured sesamoid at the end here. So when you look at the big toe joint, this is the big toe joint. Here is a sesamoid right here, this little circular thing, and has two pieces to it. See, there's a pole on the top and a pole on the bottom, and a pole right here and a pole right here. If you look and there's a straight line, that normally lets us think that it's a bipartite or two-part bone. If it's kind of jagged like this, you're thinking it's more of a fracture of it. Once again, a bipartite is a two-piece bone. And if there's a bigger gap between there, many times there can be a fracture. For example, this is before and this is kind of after. A bigger gap makes us think more of a fracture in that when you look at the x-ray. In terms of what it feels like, they feel very similar. A fracture or a bipartite sesamoid, they can look very similar on the x-ray. And they may hurt, especially if things kind of spread out, because there is a complex right here that moves everything. Let me show you here. When you have a sesamoid, there's a muscle, and then there's like a tendon, like ligament here. And as it pulls, as the big toe goes upward, see, as the big toe bends, it's going to pull on those sesamoids, and it can cause them to spread apart. And this is the apparatus right here that you see underneath the big toe joint. And as they spread, they can become painful. Every time you move it, it can become painful. That's why one of the treatments is to prevent it from moving. Okay. This is another example of a two-pieced sesamoid. If you do an ultrasound and you see that one of the sesamoids, see there's one sesamoid here, one here normally, and this one flares up or lights up, that makes you think more of a fracture. Another example here of some other diagnostic imaging, one lights up, and right here, one lights up a little bit more. Those are ideas that you would think about more of a fracture. I like to use this sesamoid fracture treatment evaluator when I look at things. What's most effective, what's least effective? In my opinion, you have to look at reducing inflammation and repairing the tissue, repairing that. I find shockwave most effective because the sesamoids don't have the best circulation to them, so this can help. I don't use amnio that much. Cortisone occasionally if there's a lot of pain. And then anti-inflammatories and icing. These can help if you haven't. These are what people usually try first. They try everything below the yellow line before they come and see me. I don't find physical therapy all that helpful for a sesamoiditis or sesamoid fracture. I find a walking boot can be beneficial to offload the area. And then if it's more stable, you can use a custom orthotic or an appropriate cushioned shoes. There's also a home sandal called an UFOS, which I really like as well for sesamoid fractures. I'll put another video here of other sesamoid fracture videos if you want to learn more. I would go to drpelto.com to learn. I have resources for you on pretty much anything that you need, and there's a way you can ask questions as well if you want to learn more. Put your question underneath here too. If you have a question, I'll try to answer it if I have some time. And once again, thank you guys. Have a great day.